Welcome back, everybody. Medical Monday, of course, and October is Breast Cancer Awareness Month. East Cooper Medical Center is the ABC News 4 hospital expert, and Dr. Jennifer Craney is here today to talk about breast screening guidelines, so important during this month. Dr. Craney, welcome to the program.
Thank you.
Well, tell me about the guidelines, and there's some new ones that came out and kind of the screening process, and what do women out there need to know?
Well, the last screening guidelines were a little bit questionable and caused a lot of confusion with women, but basically the Society of Breast Imaging, the American Cancer Society, the American College of Radiology, and the American College of Obstetrics and Gynecology still recommend screening at age 40 and every year after that.
Oh, wow.
And it's so important with the younger women because they have dense breast tissue and cancers tend to grow a lot faster in the younger women. So yearly screening is so important, especially between the ages of 40 and 50.
So what we're talking about right now is a mammogram, and you need to get one of those every
Yearly
year when you're over
mammograms,
40?
Yes.
Okay, good to know right there. What about high-risk patients, and what kind of defines you as high risk? How would you know if it runs in your family?
If it runs in the family, that definitely defines high risk, especially if your sister or a mother had premenopausal breast cancer. And what we say for those women is that if your mother or sister had breast cancer in their 40s, you should start 10 years before their age.
Oh, wow.
So if they were 45 at the time of their diagnosis, you would start your screening mammograms at 35 instead of 40. And some women can choose to have a breast MRI in addition to the mammograms, where they stagger them every 6 months. And then some women who have dense breast tissue are at a slight increased risk of breast cancer, and they can choose to talk to their doctors about having breast ultrasound as a screening study. That's still debatable in the literature, but a lot of women are choosing to do that.
Well, it really is this early detection that is saving women's lives.
It's saving women's lives, and it saves money in the long term because it's less treatment for the patient if you catch it very early, and it's better survivorship.
What would you say is the trend right now? Do you see cancer rates in women younger and younger, or does it really start around that age 40?
Definitely, no. So many younger women are getting it, and we don't know why. There are so many different factors that could be attributing, but we see these in 20-something-year-olds now.
Right. So I guess if you are 20 years old or in that 25 to 30 age range, I mean, is there a symptom that you would kind of start to experience that would say, I need to go get this checked out?
Not really, and the best thing that women can do for themselves is to do their monthly self-breast exams, even from teenager on. Learn what the breast tissue feels like, look for changes, and to have continual yearly clinical breast exams with their physicians. Yeah,
now you are over at the Charleston Breast Center, which is an affiliate of East Cooper Medical Center, but we want to make sure that women out there know that you can get these screening processes, these mammograms and these MRIs at both locations, correct?
Yes, the Charleston Breast Center offers all 3 studies and biopsy capabilities for all 3, and the hospital offers the same as well.
All right. Well, what about resources for women who can't afford those screening programs and mammograms? I know that there are mobile units right now that are going out into communities, kind of lower income communities, trying to make sure that every woman really gets covered and sees this before it gets worse.
Definitely. The best resource is the Low Country Komen affiliate, Susan G. Komen affiliate of the Low Country, and that number's on the website, and they can help women decide if they are a candidate for a state-funded Best Chance program or to guide them to the appropriate place to have free mammograms through one of their grant locations.
Okay.
That includes the mobile units.
And that website would be the eastcoopermedicalcenter.com?
No, it's on the internet. It's just Komen, Low Country affiliate.
Okay. Great. Well, make sure you check out that. And, of course, for all the survivors and all the people that are supporters out there, we've got the Race for the Cure coming up.
Definitely, October 19th.
Right, October 19th. Tom and I will be out there with a lot of other ABC News 4 people, as well as some East Cooper medical folks as well. Well, Dr. Craney, thank you so much for coming. We really do appreciate that. And thank you for spreading that information.
Thank you.
Much more Low Country Live after this. Make sure you stick around.